Hey guys, Dr. Greg here. Let's talk about the liver. In decades of being in practice, tens of thousands of patients, in my opinion, the number one impacted organ when it comes to chronic infection, autoimmune disease, and people just not doing right, even hormones being off, is the liver. And yes, you've heard about liver detoxes. A lot of them just make you poop so you feel better. The reality is, don't guess, test. So we're going to talk about three, maybe four numbers here. So the first one is albumin. So in functional medicine, we want albumin between 4.0 and 5.0. The next two numbers are AST and ALT. Ideally, we want those numbers between 10 and 20. Lastly, alkaline phosphatase. And these numbers all do vary a bit by age and sex. So alkaline phosphatase, somewhere between 45 and 90 or so. Okay. So if your liver, and by the way, so I shot another video about the white blood cells and how we respond to stress. So if your liver is healthy and it's under stress, we will actually see elevated liver enzymes. So we'll see those numbers high, which is an appropriate response to health, right? Now, the scary thing, just like low white blood cells, the scary thing are low liver enzymes. And I just had a great talk with a PhD biochemist from Utah last Friday, and we had this discussion. And he said the research unequivocally points to it, and he completely agrees. By the way, he's been in the biochemistry world for decades. So if your liver is responding to a stress, and it can no longer make an adequate amount of those enzymes, it can't even produce them. So the real concern is even low liver enzymes. So albumin below 4, AST and ALT 10 or below, even alkaline phosphatase 45 or 50 or below. So again, we don't guess, we test. Now, what does the liver do? So let's talk about, so number one, if there's infection, every 3 to 6 minutes, every drop of blood in your body goes through your liver. So if there's infection, your liver is taxed. If you've ever had your gallbladder taken out, that's really a sign of liver stress, because your gallbladder is an extension of your liver. It means your cystic ducts are attacked, and your body says, hey, I'm going to show a symptom. Hormones. Holy cow. So many of your hormones have liver control over them. Even think, by the way, if you have a thyroid condition, 60% of inactive thyroid hormone, T3, 60% gets converted in the liver. 60%. So it's not a lack of synthroid or levothyroxine. It may be liver